Hello, my name is Alex Reeder, and today I'm going over the LexCorp's OSHA 300 logs. What is a near miss? A near miss refers to a situation where an accident or undesirable event almost happens but is narrowly avoided. It implies that a potential hazard or danger was present, but through luck, quick action, or other factors, the incident did not occur. Near misses are significant because they provide valuable opportunities for learning and improving safety measures to prevent future accidents. They can occur in various contexts, such as workplace safety, transportation, healthcare, and everyday life. This graph here represents near misses per each day of the week. Trends, peaks, and valleys. Monday, the graph shows a relatively consistent trend with slight increase in near misses towards the beginning of the week, peaking on Monday. Tuesday, near misses decreased slightly from Monday but remain relatively high compared to later in the week. Wednesday, near misses increased again, reaching a peak similar to Monday. On Thursdays, near misses start to decline noticeably from Wednesday, indicating a decreased trend towards the end of the week. Friday, there's a significant drop in near misses, suggesting a distinct decrease in incidences towards the end of the week. Saturday and Sunday, near misses are at the lowest point during the week, indicating a dip in activity or different types of hazards compared to weekdays. Peaks are observed on Monday and Wednesday, indicating days with the highest near miss counts. Valleys are seen on Fridays, Saturdays, and Sundays, indicating days with the lowest near miss counts. Monday and Wednesday, and to some extent Tuesday, presents problem areas with higher near miss counts. These days offer opportunities for targeted intervention to reduce incidences and promote safety. Insights and recommendation. Prioritizing risk reduction, focus on days with the highest near miss counts, Monday, Tuesday, and Wednesday. Address workload and fatigue, manage workload, and promote breaks to reduce errors and accidents. Foster a safety culture, encouraging reporting of near misses to facilitate learning and improvement, and continuous evaluation, monitoring trends and adjust strategies to ensure ongoing effectiveness. This graph represents near misses for group members and non-group members. Trends, peaks, and valleys. Group members have 265 near misses, 88.3% of the total, while non-group members have 35 near misses, 11.7% of the total. The trend indicates a significantly higher occurrence of near misses within the group compared to incidents involving non-group members. The peak is observed in near misses among group members, constituting the majority of incidences. This suggests that primary focus should be on the internal process and interaction within the group to address potential safety concerns and minimize near miss occurrences. The valley appears in near misses involving non-group members, reflecting comparatively low frequency of incidences. While fewer in number, these incidences still require attention to ensure comprehensive safety measures and mitigating risk beyond the immediate group dynamics. Insight and recommendation. Internal communication and coordination, enhancing communication channels and coordination mechanisms within the group to reduce the likelihood of near misses. External awareness and vigilance, increase the awareness and vigilance among group members regarding potential risks to non-group members, fostering a culture of safety and responsibility beyond the group boundaries. The group underscores the importance of proactive measures to address near misses with a focus on internal dynamics and extending safety measures to encompass interactions with non-group members. By prioritizing internal communication and awareness while also acknowledging the impact on external stakeholders, organizations can mitigate risk and foster a safety environment for all involved parties. This graph shows the number of near misses in a 24-hour day period. Trends, peaks, and valleys. The trend in the graph indicates that near misses follow a somewhat cyclical pattern throughout the day, with periods of increased activity followed by relative lows. During the early morning hours, 1 to 6, there are generally fewer near misses, suggesting potentially lower activities or heightened vigilance during these at times. However, there is a sporadic spike at 2, 4, and 6, indicating that even during the quieter periods, there are still some instances of near misses occurring. The peak in near misses are most prominent during the late morning to early afternoon hours, particularly between 10 and 3. The period likely corresponds to high-risk activity levels, increased workload, and possible fatigue or distractions, leading to higher frequency of near misses. The peak at 3 with 55 near misses represents a significant surge in incidences during this time frame. Valleys are low point occurrences during the early morning and late at night. These periods likely coincide with lower activity levels, reducing staffing, and possibly stricter safety protocols or procedures that help mitigate the occurrence of near misses. Insight and recommendation. The problem areas are opportunities for improvement lie in addressing the factors contributing to the peaks and near misses, particularly during the late morning to early afternoon hours. This can involve implementing measures to reduce workload, enhance supervision, provide additional training on safety protocols, or introduce tools and technologies to aid in error prevention and detection. Overall, the graph represents a comprehensive overview of the distribution of near misses over a 24-hour period, highlighting both high-risk periods and relatively safer times. By analyzing these patterns, organizations can tailor their safety strategies and interventions to effectively mitigate the risk of near misses and promote a safer working environment. Additionally, the graph underscores the importance of ongoing monitoring, analysis, and proactive measures to continuously improve safety performance and prevent potential incidences. This graph represents OIR, operating incident rate. Trends, peaks, and valleys. The overall trend in one of the gradual increase throughout the year with intermittent fluctuations. This suggests a progressive improvement in safety measures are reporting over time. Peaks occur at the end of each month, indicating a spike in safety measures or incidences recorded. The highest rate is observed in December, indicating the accumulation of efforts or possibly an increased focus on safety towards the end of the year. Valleys are at the beginning of each month, suggesting a reset or drop in recorded safety measures. This can indicate a need for consistency in monitoring and implementing safety protocols throughout the month. Insight and recommendations. The fluctuation within each month, especially in the middle months like August, September, and October, suggests potential areas for improvement. These fluctuations might indicate inconsistencies in safety practices or reporting, highlighting the need for more standardized procedures. The graph reflects the monthly variations in safety measures or incidences recorded, showcasing a pattern of increasing attention towards the safety towards the end of each month. This could be due to reporting deadlines, safety audits, or other factors. However, the fluctuation within each month underscores the importance of maintaining consistent safety practices throughout the year to ensure a safe working environment. Identifying and addressing these fluctuations can lead to improved safety outcomes in the long term. This graph goes over first aid, near misses, and recordables. Trends, peaks, and valleys. Recordables. The consistent decrease from January to December suggests a declining trend in recorded incidents throughout the year. However, there's a notable decrease from March to July, indicating a potential shift in safety practices or reporting. First aid and near misses both exhibit relatively stable trends with minor fluctuations. This stability can indicate consistent safety protocols in place, with the variation warrants attention to identify any underlying causes. Peaks and valleys. Recordables peaks in January to March, indicating a higher incident rate at the beginning of the year. This could be due to the various factors such as seasonal changes, increased workload, or changes in procedure. First aid and near miss peak in December might suggest heightened risks or incidences occurring toward the end of the year, possibly due to factors like holiday-related distractions or end-of-the-year rush. Recordables. Valleys in July to December significantly lower incident rates during these months. However, the sharp decline from March to July raises concerns about potential underreporting or changes in safety practices. First aid and safety near misses. Valleys in July to December indicate relatively quieter periods in terms of incidences, but consistent monitoring is necessary to ensure these trends aren't making underlying issues. Insight and recommendations. Recordables. The significant drop in recorded incidences from March to July is a key area of concern. It can indicate a need for a reinforcement of training, enhanced reporting mechanisms, or close examination of workplace conditions during these periods. First aid and near misses. Despite the stable trends, any deviation from the norm should be investigated to identify potential problem areas. Consistent analysis and improvement of safety practice protocols are essential to mitigate risk. Overall, the graph provides valuable insight into the safety organization's performance over the year. They highlight patterns, fluctuations, and potential areas for improvement. By analyzing the trends, management can implement targeted interventions to enhance workplace safety and reduce the occurrences of incidences. Regular monitoring and adaptation of safety measures based on data-driven insights are crucial for fostering a safe working environment. Declining trend of recordables. The consistent decrease in recordables throughout the year, especially from March to July, indicate a potential improvement in safety practices or reporting. However, it also raises concerns about underreporting or compliance and safety vigilance. This graph shows type of incidences. Trends, peaks, and valleys. Mobile equipment peaks with the highest number of incidences at 81. Ergonomic peaks with a significant number of incidences at 36. Chemical exposure peaks with a considerable number of incidences at 30. And walking working surfaces peaks with a notable number of incidents at 24. PPE also peaks with a substantial number of incidents at 19. Culture, lockout, tagout, falling parts, electrical dust, and insects have relatively low incident counts. Problem areas. Mobile equipment, the high number of incidents suggests a critical area needing attention, possibly indicating issues with training, maintenance, or operational procedures. Ergonomic, the significant number of incidences highlight potential ergonomic hazards in the workplace, indicating the need for ergonomic assessments and adjustments to workplace or procedures. Chemical exposure, the category indicates potential risks related to hazardous substances, emphasizing the importance of proper handling, storage, and use of chemicals, as well as adequate PPE. Working surfaces. The notable number of incidences suggests challenges with slip, trip, and fall hazards, underscoring the need for regular inspections, maintenance, and safety measures to prevent accidents. PPE. This substantial number of incidences indicates potential issues with PPE usage or availability, necessitating review and reinforcement of PPE protocols and provision of appropriate equipment. Insights and recommendation. The graph provides a breakdown of safety incidences by category, highlighting areas of concern and opportunities for improvement in the workplace practices. By analyzing the trends and identifying problem areas, organizations can implement targeted interventions to mitigate risk and enhance overall safety performance. High incidence categories. Categories such as mobile equipment, ergonomics, and chemical exposure have significantly higher incident counts, indicating critical areas of concern that require immediate attention. Incident rates in categories like culture, lockout, tagout, falling parts, electrical, dust, and insects have relatively low incident counts, suggesting areas where safety measures may be effective or incidences are less frequent. Now I'm going to go over one of the more common incidences happening on the airport. The employee is driving around the perimeter of an airport on public road, checking fences when they are found speeding in a 55-mile-per-hour zone. Now I'm going to ask my 5 whys. Why was the employee speeding? Because they were driving above the speed limit in a 55-mile-per-hour zone. Why was the employee driving above the speed limit? Because they are unaware of the speed limit in that area. Why was the employee unaware of the speed limit? Because there was a lack of clear signage indicating the speed limit along the airport perimeter road. Why was there a lack of clear signage indicating the speed limit? Because the airport authority did not prioritize or invest in proper road signage for speed limits. Why did the airport authority not prioritize or invest in proper signage for speed limits? Because there was insufficient communication or coordination between the airport authority and relevant departments responsible for road infrastructure maintenance and signage. Now we're going to take a look at the HIRA chart. The trend in the graph shows the frequency of different types of incidences categorized by their severity level. Green meaning negligible, yellow tolerable, and red intolerable. Peaks and valleys. Peaks are observed in categories such as mobile equipment with 60 incidences categorized as intolerable and chemical exposure with 25 incidences categorized as negligible. Valleys can be found in categories like guarding with only 1 incident categorized as intolerable and electric with 1 incident categorized as negligible. Problem areas. Problem areas or opportunities include mobile equipment and chemical exposure where there is a high significant number of categorized as intolerable. Additionally, fire and dust have a high number of incidences categorized as intolerable compared to negligible or tolerable. Mobile equipment. The category stands out as a significant problem with 60 incidences categorized as intolerable. It indicates a serious concern regarding the safety practices associated with the use of mobile equipment. Addressing this issue could involve revising operating procedures, enhancing training programs, or implementing stricter safety protocols. Chemical exposure. While the number of incidences is low compared to mobile equipment, the higher proportion of incidences categorized as intolerable, 25, suggests the critical need for improved safety measures when handling chemicals that might involve better storage practices, more rigorous personal protective equipment requirements, or enhanced training on chemical safety protocols. Fire and dust. These categories, while not high in total incidences, have a notable number of intolerable, 2 for fire and 3 for dust. This indicates potential weakness in fire prevention measures and dust control procedures. Improvement in fire safety protocols such as regular inspections of fire suppression systems and better training on fire prevention could help mitigate these risks. Guarding and electrical. Although these categories have lower total incident numbers, they still warrant attention due to the presence of incidents categorized as intolerable. Strengthening equipment guarding protocols and ensuring proper electrical safety measures are in place can help reduce the occurrence of intolerable accidents in these areas. Insight and recommendation. The graph represents the distribution of incidences across different categories and their severity level, providing insight into areas where improvements are needed to reduce the frequency of intolerable incidences and enhance overall safety. Now we're going to take a look at the cost of occupational injuries and illness recordables. As you can see, the price is pretty high, and heat prostration and hearing loss are the 2 most expensive with their additional sale total cost. Cost of occupational injuries and illness is near missing. And the two highest are multiple physical injuries and dislocations, coming in at $5 million apiece. Fixing high-risk near misses. Mobile equipment. This near miss likely scored high due to potential for severe accidents involving mobile equipment such as collisions, rollovers, or entanglements. Control measures could include implementing strict traffic control measures such as designated routes and speed limits, providing comprehensive training for equipment operators, installing proximity detection systems or collision avoidance technology, and conducting regular maintenance checkups to ensure the equipment is in optimal condition. Chemical exposure. High scores in this category may result from potential hazards associated with chemical exposure, including respiratory problems, skin irritation, or toxic effects. Control measures could involve using engaging engineering controls like ventilation systems or enclosed workplace to minimize exposure, providing appropriate personal protective equipment such as respirators, gloves, and goggles, implementing poor handling and storage procedures for chemicals, and conducting regular monitoring and testing for airborne contaminants. Ergonomic near misses are related to ergonomics. Ergonomic near misses related to ergonomics may score high due to the risk of musculoskeletal injuries from repetitive tasks, awkward positions, or heavy lifting. Control measures may include redesigning workstations or tools to reduce ergonomic stressors, providing ergonomic training to employees to promote proper body mechanics, implementing job rotation or task variation to minimize repetitive strain, and conducting ergonomic assessments to identify and address ergonomic hazards. Fall. Fall scores high in this category could be attributed to the potential for serious injuries resulting from falls from heights or on the same level. Control measures may involve installing guardrails, safety nets, or personal fall assist systems, conducting regular inspections of walking working surfaces to identify, control, and address hazards, providing fall protection training to workers, and implementing procedures for safe use of ladders, scaffolds, and elevated work platforms. Bloodborne. Near misses involving bloodborne pathogens may score high due to the risk of exposure to infectious diseases through contact with blood or other bodily fluids. Control methods can include providing vaccination against bloodborne pathogens where applicable, implementing universal precautions such as gloves, masks, and other PPE, and establishing procedures for safe handling, disposal, and cleanup of contaminated materials, offering training on infection control practices and proper response to exposure incidences. Now I'm going to go over why LexCorp's OSHA 300 logs were inadequate. Lack of details and incident descriptions. The OSHA 300 log requires detailed descriptions of incidences to accurately capture the nature and severity of each incident. From the provided data, many incident descriptions lack sufficient detail, making it challenging to assess the severity and potential hazards associated with each incident. For example, there are many cases with no description about what happened as well as no precautionary actions or what the employees should have done correctly. Correction. To address this issue, each incident should be described in detail, including factors such as type of chemical involved, the specific equipment or machinery involved, the location of the incident, and any contributing factors or root causes. This information helps to provide a clear understanding of the incident and facilitates better analysis for implementing preventive measures. Now we're going to go over the wellness program that I will implement at LexCorp's workplace. Smoking is chosen as the focus area for our wellness program based on the findings of the Brown LLC Population Health Risk Study. Smoking not only possesses significant health risks to individuals, but also has a broader implication for workplace productivity and healthcare costs. By prioritizing smoking cessation, we aim to create a healthier and more productive workplace, ultimately reducing healthcare expenses and improving overall well-being. The goals of the smoking cessation program: decrease the prevalence of smoking amongst employees by 25% within 1 year, improve employee health outcomes and quality of life by supporting smoking cessation efforts, reduce healthcare costs associated with smoking-related illness and absenteeism, and cultivate a supportive and smoke-free work environment that promotes wellness and positive lifestyle choices. Smoking cessation program details. The components of the program will have a smoking cessation workshop and counseling sessions led by qualified professionals, distribution of nicotine replacement therapy, NRT, products and other cessation aids, access to digital resources and mobile apps for personalized support, and creation of smoke-free zones within company premises. Employee participation. Enrollment in smoking cessation workshops and counseling sessions, utilization of provided cessation aids and digital resources, compliance with smoke-free policies within the workplace, and active engagement in peer support groups and wellness activities. Communication strategy and incentives. Communication channels, company-wide email announcements, internal newsletters and bulletin boards, and communication strategy and incentives of the smoking cessation program. Communication channels, company-wide email announcements, internal newsletters and bulletin boards, and intranet portals with dedicated smoking cessation sections. Message content, promoting the benefit of quitting smoking for individuals' health and workplace productivity. Provide detailed information about programs offering resources and support available. Encourage a culture of support and accountability among employees. Rewards and incentives. Recognition for employees who successfully quit smoking, such as certificates or public acknowledgement. Incentives for participation, such as wellness programs, points, gift cards, or discounted gym memberships. And quarterly raffles or prize drawings for active participants in the smoking cessation activities. Measurements and evaluations. Metrics. Prevalence of smoking among employees pre- and post-program information. Participation rates in smoking cessation workshops, counseling sessions, and support groups. Employee satisfaction with program offerings and perceived impact on personal health. And reduction in healthcare claims related to smoking-related illnesses and absenteeism. Evaluation methods. Regular surveys and feedback sessions to gauge employees' perceptions and experiences with the program. Analysis of the healthcare utilization data to qualify changes in smoking-related healthcare costs. And tracking of large-term outcomes, including sustained smoking cessation rates and improvements in overall health metrics. Continuous improvement. Utilization of the data-driven insights to refine program strategies addresses emerging challenges and optimizes outcomes over time. Regular review and adaptation of program components based on feedback and evolving practices in smoking cessation interventions. Now I'm going to go over why we will not be purchasing or partnering with LexCorp. LexCorp's Aviation company has been under scrutiny due to concerning safety issues, particularly regarding its poor safety culture, notably in the management of mobile equipment. This report aims to provide an overview of the safety concerns observed within the LexCorp and implications of the issues on the decision-making process regarding potential investments or partnerships. The safety culture assessment. Analysis of incidents report indicates a consistent pattern of safety lapses related to the operation and maintenance of mobile equipment within LexCorp. Regulatory compliance audits reveal deficiencies in safety protocols, including inadequate training programs, insufficient maintenance schedules, and lax enforcement of safety regulations. Interviews with current and former employees highlighted pervasive culture of compliance regarding the safety procedures, with reports of shortcuts taken and safety concerns dismissed. LexCorp's mobile equipment problems. Maintenance practices. There is evidence of inadequate maintenance practices for mobile equipment, including irregular inspections, delayed repairs, and insufficient documentation of maintenance activities. Training deficiencies. Employees responsible for operating and maintaining mobile equipment lack comprehensive training on safety protocols, leading to increased risk of accidents and injuries. Risk management. The absence of robust risk management systems exacerbates the safety vulnerabilities associated with mobile equipment, as there is a limited proactive identification and mitigation of potential hazards. Implication for decision making. The investment risk. The poor safety culture at LexCorp poses a significant risk to potential investors, including liabilities arising from accidents, regulatory fines, and reputational damage. Operational performance. Safety lapses can impact operational efficiency and reliability, leading to disruptions in service delivery and increased operational costs. Legal and regulatory compliance. Non-compliance with safety regulations exposes LexCorp to legal and regulatory sanctions, jeopardizing its license to operate and results in financial penalties. The poor safety culture observed within LexCorp's Aviation company, particularly concerning the management of mobile equipment, raises significant concerns regarding its operational integrity and viability as a potential investment or partnership opportunity. Addressing these safety issues is imperative to safeguard the well-being of employees, passengers, and stakeholders, while also mitigating financial and reputational risks associated with safety lapses.